So I'm Allyson Todd. I'm a research officer and a PhD candidate at the Youth Well Lab at the University of Sydney, Australia. So I have a background in global health and public health, and I work in community health across two connected initiatives. First being the Health Hive, which supports young people to be active partners in community health research and action. And the other is the Healthy Places, Healthy Futures Coalition, which is a new initiative funded by the Charles Perkins Centre that aims to advance adolescent health and chronic disease prevention through a planetary health lens across the Asia Pacific. But with a key focus is adolescents as active community partners.
Okay, okay, thank you. And can you, because you're in Australia, can you say a little bit how community health is organized in Australia? Uh, how visible is it? Is it how the funding is? How is it organized?
Sure. So, yeah, within Australia, I guess community health operates within our strong decentralized public health system. So that means that funding and delivery largely sits at the state or local health districts, which means that visibility and resourcing can vary by location. But I guess a real strength is a multi-sector collaboration that tends to occur in community health, so between government, community organisations, and in research. So I guess these partnerships are where the most meaningful community health work happens.
Mm.
And I guess generally within Australia, we have a well-educated public health workforce, but I guess there is a tendency to prioritise managing our chronic disease burden, so more in a hospital setting over prevention. So there's often a stronger focus on individual responsibility rather than, I guess, the broader determinants of health. So I'd say that strengthening investment in community level preventive approaches, including how we respond to things like climate change, I guess, will be an important shift needed.
Yeah, yeah. And are people trained in community health? Is there special courses or education?
Yeah, so I think within Australia, I guess probably different terms of terminology used. So I guess we have a lot of public health degrees, and health science tends to be common approaches, and then may specialize in things like health promotion or nurse practitioners focusing on community health.
Okay, thank. What did you learn in the last couple of years about community health and particularly about connecting planetary health and climate justice and community health?
Yeah, so I guess what I've learned, I guess, is that planetary health and climate justice, I guess, they only become meaningful when they're grounded in communities. So through initiatives like Healthy Places, Healthy Futures Coalition, it's clear that community-led and multi-sector approaches are essential for translating global challenges into local action. So clearly, like health, environment, food, and like social systems are deeply interconnected, but no single sector, I guess, can address challenges like climate change alone. And so I guess a key insight has been also recognizing that adolescent health is planetary health. So adolescents are among the most vulnerable to climate change, yet they remain critical agents for future transformation. And they're consistently underinvested in. So I guess there's a real disconnect between how we frame global challenges, including climate change, and how we approach community and prevention at the local level. So I guess bridging planetary health, climate justice, and community health ultimately requires it ultimately requires sustained and targeted action and investment in adolescence and prevention and community level action. So not as separate priorities, but as a unified response.
Yeah, thanks. And one of the topics that we will address is the mobilizing of communities. And what can you say something about what your main learnings are in that area?
Sure. So I guess a key learning is that effective community mobilization is about genuine partnership and not just a one-off consultation or a meeting or getting them to fill out a survey and not necessarily implementing those actions. So I guess through initiatives like Healthy Places, Healthy Futures, and youth-led initiatives like the Health Hive, I've learned that mobilization works when trust is built over time and lived experience is genuinely valued. And communities have real influence over decisions that affect their health and their futures. So I guess a key to avoiding tokenism is recognizing that communities, including adolescents, are experts in their own lives. And so that means creating the structures and supporting shared decision making and building local leadership capacity. So I guess that means not just inviting people to the table, but ensuring that they help shape what happens there as well.
Yeah. So, as a professional, what advice can you give to the next generation of community health workers?
Yeah. So I think community health is strongest when it's collaborative and grounded in place. So if you are interested in planetary health and climate justice, you could get involved in initiatives like Healthy Places, Healthy Futures Coalition, which aims to bring together young people as well as people working across different sectors and disciplines and in community health. So I'd encourage, I guess, the next generation to seek out diverse and hands-on opportunities to build their experience and their capacity. For example, if you're a young person, initiatives like the Health Hive offer a free online course where you can learn how to get involved, whether it's as a co-researcher, an advisor, or a partner shaping work that affects young people's health. And whilst built in an Australian context, it's accessible worldwide. So I think the key is just finding opportunities that are of interest for you and seeking out different ways because I guess you never know what pathway it might take you as
No,
well.
great. Okay, thank you very much, Alison, for the interview.
Thanks so much. Thanks
Yeah.
for the opportunity.